more than that have not. Broward County announced several cases within the past 24 hours. The health and safety of our Broward County public schools community is paramount. If our teachers aren't healthy, they can't learn. If our students aren't healthy, they can't learn. And if our teachers aren't healthy, they can't teach. For weeks, we have emphasized prevention. And I want to thank our district's students, staff, and parents for prioritizing and raising awareness about the importance of proper hygiene. Our Broward County Public Schools community, students, families, staff, and community members have absolutely stepped up to the plate. At this time, I would like to invite Superintendent Robert Runcie to share additional information from the district.
Thank you, Donna. Good afternoon, everyone. This morning, I reached out to our neighboring districts, initiated some conversations with both superintendents in recognition that our districts are inextricably linked. I wanted to get a pulse for where everyone was relative to the challenges we're facing with the coronavirus. And I will tell you that we are very much connected. In Broward County, I believe somewhere close to a quarter of our employees live in Miami-Dade, work here. Many of Dade's employees live in Broward County, and we have the same situation with Palm Beach. And if you look at the three districts collectively, we would be the second largest public school system in the United States. So our opportunity to impact how this challenge we have with this virus impacts our communities and this region is significant. So as the three largest districts, we try to make sure that we align our strategies. I also today did a call, a meeting with our business leaders, our government leaders in Broward County, community organizations, to alert them to the possibility of what would occur should we close schools and have a significant impact on the community, a significant ramifications. As you can imagine, we have workforce impacts, economic impacts as well. So that was a good, healthy conversation. And I want to announce today that Broward County Public Schools will close temporarily in response to the threat of coronavirus. And that means we're closing schools next week, but we're not closing operations, and I'll distinguish the two. And by the way, our spring break is the following week, so we effectively would be closed for 2 weeks. All staff will report to work on Monday and Tuesday according to their normal schedule. Tuesday, in fact, we actually had as a non-instructional day because that's an election day. We have over, I believe it's somewhere like around 120 or more polling sites. So we had no instruction going on those days. Students would have returned on Wednesday, Thursday, and Friday. So Wednesday, Thursday, and Friday, those are all working days. Required school and district services. Staff must report to work according to their assigned position. We are advising our supervisors and management staff to provide flexibility in case we have employees who need to work at home for any particular health reasons. And then again, moving into the following week, we will observe our normal spring break work schedule. So in effect, our students would be missing about 2.5 days of instruction. So there's not as big as a impact given what our schedule has been. So what I want to, again, reemphasize is that every action has a reaction. And we know that if children are home rather than at school, there's a consequence to their parents who may work during the day. They need childcare services. And in cases where we know that if they're in school and we have cases where coronavirus is found in our schools, and those students who are not affected by the virus, they'll have to actually go home. So part of our strategy that we had before, when students are identified, they're isolated, we would require parents or guardians to come and pick them up. We know that creates a challenge as well. So again, we will temporarily close schools in order to safeguard our students, our teachers, staff, parents, and the greater Broward County community against what is clearly an extremely contagious disease. As mentioned before by Ms. Korn, we're definitely ready. So I'm going to get into some particulars of how we will provide support to families and children as we move forward. So first, before and after care, in particular, child care. So we're ready to provide before and after school child care services. We are going to prioritize district staff, hospital, emergency staff, and first responder with child care services to the programs that we'll set up at a number of sites around the county. There's a number of locations. I believe right now we have about 9 or so sites that we've set up, and those details will be provided on our website. I'm not going to read through all of those. So that will be available. Students who will attend must be Broward County public schools or charter school students. They have to show a Broward County school identification number. So we are requiring those credentials to be provided in order for them to take advantage of it. And again, we're giving priority to Broward County emergency personnel, such as police, firefighters, as well as medical staff and personnel. On food, that's one of the first topics that comes to mind when we think about closing food, because our schools, because we know so many of our students rely on this district for basic meals that they need. Over 60% of our students in this district rely on free and reduced meals. And so that's a priority that we certainly take into consideration, and we are ready to feed our students during the time that they are actually home. We've designated 8 schools for meal preparation and distribution. There are high schools, Boyd Anderson, Blanche Ely High School, Dillard High School, Flanagan High School, Hallandale, Miramar High School, Nova, and Taravella High Schools. We've done that so we have some distribution and coverage throughout the entire county. Breakfast meal service will be available from 8 to 10 a.m. at those sites, and lunch will be available from 11 a.m. to 1 p.m. at those particular sites as well. Meals will be made available this coming Monday, March 16th, Wednesday, March 18th, and Thursday, March 19th. Students, again, will need to present their credentials, their school identification, and they will receive a meal for themselves as well as family members if they happen to be present at that time. Meal distribution will be walk up or pull up to the designated distribution sites on campus. We also, on our call today with our community partners, we are going to continue to partner with several organizations that ensure that we can address food insecurity challenges that we know exist in our communities. So Feeding South Florida, the Hunger Coalition, and the United Way, just to name a few, will be collaborating with the district to make sure that we are providing food to our students and families. On cleaning, the spring break creates a great opportunity for us to take advantage of that time to ensure that our schools are able to be cleaned and disinfected by staff. That includes our buses, any areas that are used and accessed by students and staff in this district. On the education side, the learning, what we call learning never closes, which is really about continuing education over extended periods of time. We will actually execute this plan should we extend the closure beyond spring break. So that has 3 specific components. And before I mention that, I just want to emphasize that next week our third quarter ends on Thursday. And we certainly appreciate the tremendous work that our teachers do. Our teachers always work with our students with the best interests in mind, with compassion and love, and we encourage them to do that as we try to be as flexible as possible, given that we are closing next week and we'll miss a couple days of instruction. We've set up a website and infrastructure that covers three things. So we have content that's out there that's been developed, including lesson plans, project-based learning opportunities for students. The second piece of it is the availability of devices. We have devices that are ready to distribute. We would distribute those toward the end of the week of spring break or on Monday, March 30th, should we extend the closure beyond that period of time. Because if we don't go beyond that period of time, it would be normally what we would do for our spring break. Students would come back and we would resume instruction in our schools. We have also worked with some partners such as Comcast. They've had a program around for quite a while that for actually over a couple decades they've made available to school districts around the country. We certainly participate in that. It's called Internet Essentials, which provides significantly discounted internet access services for families, and so we will make sure that we continue to push that. Should we have an extended closure period, we want to make sure there's equity in this district and our community, and all our students would have an opportunity to not only get a device, but have connectivity as well. Regarding our hourly employees, this district has over 30,000 employees. About half of them are teachers. The rest of the support staff, everyone from our TSPs to our substitute teachers, to our food service workers, our custodians, our bus drivers, our mechanics, our maintenance workers, all of these staff make this district run to be able to provide the quality of educational experiences that we're able to deliver to our students. And as the county's largest employer, we have every intention to continue paying our employees. All permanent, full, and part-time employees will receive pay according to their normal schedule. Any questions, you can direct them to your school or department. So this is a message for our employees. Benefits eligible employees and their covered dependents can always contact our Aetna customer service line at 1-800-562-7822 for questions regarding coverage, service, and pharmacy. Again, we also have our employee assistance program, and I also want to note that Aetna will waive co-pays for all diagnostic testing related to the coronavirus. And for the next 90 days, Aetna will offer zero copay for telemedicine visits for any reason. So we're trying to make sure that our employees, there are no barriers to them receiving the health care services that they need. This is a uncharted territory for not only us in Broward County, but I think for this nation. And one thing I know gets humanity through these challenges, and that's if we put our differences aside and we work collaboratively, that we look out for our friends and neighbors. And I think if we do that, we will get through this challenge. And I can tell you my experience in life is that challenges can make you better. This is a very resilient community, and we will step up to this challenge and be stronger on the other end. With that said, thank you for coming today and helping to share this information with our community. I will open it up for questions. Yeah, so the school, one moment, let me make sure I give you the accurate dates on that. But the food schedule we will have is next week. So lunch will be available from 11 a.m. to 1 p.m. at those 8 sites I mentioned to you. And by the way, all of this information will be available on the Broward Schools website, browardschools.com/coronavirus. We'll have all these updates. But lunch will be available from 11 to 1 p.m., and meals will be available on Monday, March 16th, Wednesday, March 18th, and Thursday, March 19th. And we have breakfast. Breakfast is going to be available, I believe it was 8 to 10 on those same days. Yeah, breakfast will be available from 8 to 10. Do you want the list of the schools as well again? Okay, all right, great. Thank you.
So just to clarify, the students are only going to be missing 2.5 days of instruction, is that correct?
That's correct. So we had instruction on Monday. Tuesday we were closed. That's a voting day, and we wanted to, as a precautionary measure, we suspended instruction on those days since we know we were having lots of visitors that would show up on our campuses. And by the way, those voting spots in our school, they're restricted, isolated areas, and we are going to make sure that those areas are cleaned and sanitized before schools reopen again. So we had the Monday, and then we had Wednesday, half-day Thursday. So that was the schedule for instruction, and that's going to be the impact from a student standpoint. We will be providing formal communication to the State Department of Education on how we handle that. I spoke today twice with Commissioner Corcoran about this as well. I believe that they will be making some announcement today about recommending to districts about how much time they believe that they should suspend and close so that as a whole, the state can put a strategy in place to deal with the virus and contain the spread of it.
Can you clarify the staff that has to report to work next week, even on the days off on Thursday and Friday? Is that accurate?
Yes, so for next week, we are all staff reports to work on Monday, Tuesday, Wednesday, Thursday, and Friday. We were adjusting that schedule to provide some flexibility for students, for our employees. But essentially, it's a regular work week for all employees based on the schedule that they would have. However, what we're suggesting is that for Wednesday, Thursday, Friday, we would suggest that there be some flexibility with employees who need flexibility. It could either be childcare related, it could be health concerns. We're suggesting that we show some compassion and flexibility with our employees there, and we'll deal with those on a case-by-case basis. Anything else? Yes. At this time, I can't tell you what the number of students will be. I just know that we have identified 9 sites throughout the county, and we will prioritize the most critical staff in the county, as I said, first responders, emergency staff, medical and hospital staff, and then district staff will have access to those. And these are, again, they would have to present their credentials, but we want to make sure that we don't impact those institutions. You can imagine if a hospital had a number of employees who also had children but had no access to child care, decided to stay home, it would further exacerbate this community's ability to provide critical healthcare services to deal with the coronavirus. I think our healthcare systems are going to be enormously challenged. I have a daughter, actually, who's a doctor in Boston. She's an emergency room doctor, and I can tell you they're starting to get taxed already, and we're early at the onset of the spread of this virus. So we have to do what we can as a community.
Listening to Superintendent Robert Runcie announcing the closure of Broward County schools next week. The following week will be spring break. After that, they will reevaluate. Miami-Dade County Schools also doing the same thing. Both districts still offering meals to students who need them and childcare for families who need them. Both of those informations are on the official district websites.